Hi everyone, we're here at Camboro Veterinary Hospital doing a procedure or showing you a procedure on stem cell. And what we're going to be doing are several stages that are involved in the entire procedure, and with me is Dr. Jim Rummel. And Dr. Rummel, tell me what are the 4 stages that we're going to be looking at today?
Okay, well what we do initially for any dog that's a stem cell candidate is do a very thorough exam.
Okay.
We do blood work, including thyroid, kidney, liver function, all of those things. We then do a series of x-rays. We want to make sure that there is nothing else wrong, number one. And number 2, we want to identify every joint possible that we can that we're going to inject stem cells into.
Are you anticipating any number of joints in this situation?
I think so. We've had a previous injury on the left side of Daisy, and she injured her right cruciate, and we'll see oftentimes there are other things going on at the same time.
And Daisy is a West Highland Terrier?
Yes, she's 14 years old, and just a young lady.
Oh yes, yes, in the prime of her life.
Prime of her life. So we're going to be doing that for Daisy, and then once we clear Daisy, we will be doing a procedure called a PRP, and that's collecting blood from her to make platelet-rich protein. And that is the substance that we suspend the stem cells in. It's very important because that substance also contains very, very strong anti-inflammatory compounds, which will help alleviate the pain with the arthritis almost overnight, within a couple days.
Okay, now after you do that, then how long will we have to wait till we do the final thing?
Then at the same day, we do collection, a surgery where we harvest fat, adipose tissue, and that's where we collect these stem cells, regenerative cells, that are 7 to 8 cell divisions from embryonic cells. So they're not embryonic, but they're still being able to direct themselves to change into certain tissues that are needed. The body has an injury, and it actually wakes these stem cells up in our body and says, hey, my liver's hurt, or my knees hurt, or whatever. And as we get older, they get more tired. There's fewer of them. They're harder to wake up. And so for Daisy, we're going to provide her with some new ones from her own fat.
Right. Okay. And then the final step will be what?
Well, that fat is processed over about a 3-hour period. It's cookbook. It's enzymes and spinning it down in water baths and heating and spinning it down and separating out until we get just the tissue we want.
Okay.
That is resuspended, and then we have to sedate Daisy again, and we will be injecting him into those joints that we found that needs it.
So we're going to be spending some time with you today as we go through this whole procedure.
It'll be a long day for you, I'm sure.
Okay, we're good. We'll get ready for this. Thank you. This is Daisy. She is how old?
She's a senior citizen Westie that has damaged her left knee, and we had symptoms of and signs of a cruciate injury. And the owner has decided that because we had a damaged right knee in the past and had surgery, we're going to not do major surgery. We may put a stabilizing suture in, but she wants the stem cell to help rebuild that ligament. And if we can identify any other areas on Daisy, we will also be doing stem cell in those areas. So the first part of a stem cell workup, we've already done blood work. And that blood work on Daisy consisted of a complete blood count, a chemistry panel with electrolytes and thyroid profile. And those were all normal for our girl. So the next step is taking x-rays of her entire body, which we'll review some of those x-rays later with you to show you some of the different joints maybe, and go from there.
Okay.
But we want to make sure she doesn't have any tumors inside of her that the stem cells can actually encourage.
Okay.
That's one of the downsides of stem cells. They encourage growth of certain types of tissue, and if it's some tumors, that will happen as well. So we're going to measure a Daisy, and that's a 16.
And why do we measure her?
So that we know what to set the radiograph machine, the x-ray machine at. And while he's doing that, we all have our little safety things on. X-ray has a collimator that makes those radiation rays go in a certain way, it retains them. And we have our lead aprons, we have our little badges that we have evaluated monthly to make sure we don't get too much radiation. Now hopefully she'll cooperate with this. We're going to do a lateral chest. Come on, Dave, ready? That's a good girl. That's a good girl. Easy. Okay.
Got it.
Okay. Ready. Go ahead.
She's awfully good.
Okay, so count. 1, 2, I'll hold. This is a digital x-ray. We don't have to have any developer or anything, and it's up now, actually. That's how quick.
You are cute, Daisy.
That's how quick it is. It puts it right into the computer.
Wow.
We can manipulate that. We can say that's not what we want. Okay, let's hold. You can hold our friend.
I can hold her. Daisy, Daisy.
And let me just make
Daisy,
sure.
Daisy.
Yeah, what we're looking for. We won't do big evaluations on these right now. We just want to make sure that they're adequate of what we're wanting to.
You're nervous, huh? Nervous girl.
Okay, that looks good. And we'll just be doing some other views. So
okay.
That's the process. It just now is a timely thing where we have to do each joint and the other views of the chest and abdomen and move forward from there.
Okay.
Okay.
That's good. Thanks.
Thank you very much. Okay, well, this is our buddy Daisy Stevens, and Daisy is the dog we're working on for the pre-stem cell exam, and we've talked about how important it is to make sure that these animals are good candidates. Stem cell is a wonderful, miraculous process, but if you don't have the right candidate, it's not going to work any better than anything else.
How long have you been doing stem cell here?
2.5 years.
2.5 years, okay.
Yes, and we've done close to 50 at this point. And Daisy has had previous surgery on her left knee, and that knee has been fixed. She had tore a ligament called a cruciate ligament, and she has now, as we know, torn her or damaged her right knee. And right now there's very little arthritis. We're looking at the surfaces of these bones and how they're sitting. But we do know by looking at this x-ray that there are some other problems. And part of our stem cell workup is we want to identify every joint that could possibly benefit from this, because we could treat 4 to 5 joints in this process. So if we identify those joints, we can treat them.
Give me a definition again. What is stem cell?
Stem cells, we're going to call them regenerative cells.
Okay.
Okay. Stem cells, there's a lot of that in the news. That's embryonic, and we don't need that. That doesn't even have to be part of the conversation. These are regenerative cells that are 7 to 8 generations past embryonic.
Okay.
Now they're called determinate cells, meaning that they still can change into whatever tissue needs to be determined by what's damaged.
And that generally would be what, ligaments?
Well, right now these are called mesodermal cells. You have the ectoderm, which is in the outside. The endoderm is the lining of your bowel, the inside of your body.
Okay.
And the mesoderm is all the stuff in the middle.
Okay, gotcha.
So your muscle, your ligaments, your tendons, your cartilage, most of your organ systems, those are all part of the mesoderm. Now, a stem cell procedure that we have is approved to use on tendons, ligaments, and degenerative joint disease.
Okay.
And we can use it on other things, but we can't say it's going to do this, this, or this. We have used it in certain cases.
And how long have they been doing stem cell? Not here, you said 2.5 years, but just in general. It's been a long time?
Yeah, but it's been, I don't know medically how long, to be honest with you. I think this MediVet America has been in the business probably 4 to 5 years. What's important, though, is, again, identifying these, what joints can we use these on? So we know we're gonna use it on this knee because the ligament's damaged. We may actually put a supportive device on that knee as well. So our goal is to help those stem cells, when they get there, the damaged tissue says, hey, I need some help, change into a ligament, and the stem cells because of those signalment factors, they're called, know what to do. Now, as we get older, we don't have as many stem cells or regenerative cells, and they're slower to mobilize. So when you're a kid and you fall and get a cut, it heals. Boom. When you're my age, you get it and you get a scar because it doesn't heal as fast. It's not newer tissue. It's a different type of healing process.
And how old is this dog?
Oh, you had to ask that.
I thought
it's a senior dog.
Okay.
It's a senior dog.
Is it generally done with senior dogs?
No, it can be done with any dogs, but often senior dogs have the arthritis.
But as far as joint damage, that could be a younger dog that participates in activity or just runs around the yard a lot.
I want you to notice on these hips, the left hip is not great, but it's not too bad. It has a rounded, has a fairly deep socket. Doesn't have much of a neck on it like it should, but it's decent. Look at the right hip. Big, squared off, starting to degenerate around here. So this would be one of the joints that we would definitely be doing, a second joint.
When you do stem cell and you notice a big change in the dog as far as less pain, of course, there's none of that bone on bone that you're having anymore, right? Would that be true?
Right,
okay.
Yes. And we'll talk about the some of the benefits and why it gets, you see benefits very quickly. That's not related to the stem cell part, but because of what you're suspending those stem cells in. This is the knee. The knee, this ligament that was attached here is no longer. It goes from here to here. It's called the cruciate, cranial cruciate or anterior cruciate, and it keeps your knee, when you stop, from going boom out over the top. So this is a condition in a lot of athletes, basketball players, football players, quick stopping and start injuries. And Daisy is a little Westie, so we don't, that's not that common in that breed. Oddly enough, we're seeing a lot of dogs with Lyme disease develop this. So whether that's damaging the tissue or what, we don't know yet. But now the reason this is important is this bone is shifted way out this way compared to what it should be. This should be right and clear back here. Okay, so that drawer, that's how we diagnose it. We get that knee, and I'll show you with Daisy. You have a drawer sign where that knee actually comes. I
recently dealt with this with my collie because we thought that there was going to be a tear. It turned out, thank God, that it wasn't what we had anticipated, and through a little bit of physical therapy, we had pretty good results. His number one priority is to run the length of my fence and stop and start as fast as he can. So I think we're looking at this at some point.
Yeah.
But what you're talking about, that drawer thing, and things we'll be talking about a little bit later, that's what they did with diagnosing him too.
Now, this is the heel bone, or the tarsus, the heel joint. And again, we're looking at all these joints, and we want nice, smooth surfaces. Again, you don't have to be super duper expert of something to notice changes out of the normal. Common sense. You have a nice smooth joint or bone, nice smooth. Well, this isn't smooth here. I don't know if you can pick that up or not on the.
Can you pick that up?
That's not. I can. That's as far as I can. So these are spurs coming out, little fuzzy things, little fuzzies. Look at this big thing back here. Okay, you have rather than a nice smooth joint like here. Look at this big point coming together here. So this joint has some arthritic changes as well in it. We'll have to evaluate all of them to rate which ones. He's not showing much lameness on this at this point, but this is significant. That joint's unstable, and the body's trying to lay calcium down to try to stabilize that joint.
Okay, looks good. Okay. Thank you.
Very good. So we'll we have those other x-rays, but this gives you a good idea of what we're doing and why we're doing it. We want to make sure that that Daisy does not have any cancer. So we take the chest films, we take the abdominal films, we do a full exam, we do a full blood work panel, and then we will sit down and evaluate all these. And then if everything's good, we schedule the day, and then that we'll have that as part of our program as well.
Correct.
Harvesting the fat, processing that a special way, and then re-injecting that back into the joints that we've identified.
And how many joints max could you inject it into?
Depends on how much we get, but
whenever you do it. Okay.
Four, maybe 5.
Okay.
We don't want to scrimp on it either. I also like to do an intravenous injection with a couple million cells, so that again, the body knows, those cells know where there's a problem. And I just sort of, I don't know, it might be superstitious, but I like them to go find some issues and help out.
Right. Okay.
Thank you.
Okay, well, now we've just completed taking the x-rays. Dr. Ron, would give us a little bit of a background as to what everyone just saw as far as the x-rays, and now what we're doing as our second step.
Okay, as you know, our first step was the pre-evaluation, and that included blood work, making sure everything systemically was going well, trying to identify what joints are damaged, what joints we're going to be doing the stem cell in. So now step 2 is collecting blood and creating what's called a PRP, or platelet-rich plasma. And it's a very, very powerful anti-inflammatory, but it's also what we suspend the stem cells in. So we have to collect a certain amount of blood, which the patient always doesn't cooperate 100%.
And that's what we're doing now?
That's what we're doing now. We're just collecting a large amount of blood, and then what we do, there's a process that is turned into what's called PRP. And it's a plasma that contains a concentrated amount of platelets, and those platelets, again, the materials that are inside those platelets, once they're lysed, are very, very powerful anti-inflammatories. So they actually will cut the pain within a day or two of that joint, but that doesn't have anything to do with the stem cells. Those stem cells take weeks to affect a change.
Okay, so now we're withdrawing what we need. And then what's our step going to be after this?
They're going to start to process that. Part of the team is going to be doing that. The other part of the team is going to get Daisy ready for surgery, where we actually harvest the fat.
Okay, sounds good. And we already have that, so we're ready to go to the next step.
There you go. I'm going to clip her a little more. And this, I'm going to make an incision right here in front of the belly button, and that's where there's going to be hopefully a big glob of fat.
And that's what you're looking for.
And I'm going to harvest that fat. The other place we do sometimes is behind the shoulder. I don't like that as much because there's a lot of movement. And
there's a lot of dogs, not to be rude about this, but there's an awful lot of dog at the Bark Park that I find that my biggest complaint is dogs that are overweight.
Well, there
are so many that are overweight.
Go ahead, you can do that. I'm going to let Mark take over. Yeah, about, 80%, 75 or 80% of the dogs are overweight. And there's a 15-year study Purina did on 6,000 dogs that showed healthy dogs at or below their ideal weight. So even if they're too thin, have a 22-month longer lifespan. So literally, when you're given treats and you're making your dog fat, you're killing them with kindness. It was a massive study, and that's almost 22 months is almost 2 years.
I know. We talk about that all the time. That's my biggest thing that I see at the dog park with the dogs is the overweight dogs. And I'm talking about, I can see a lab that I bet's carrying 25 extra pounds, just massive. And I think, what are you doing to that dog's hips? You're just causing so much. You're destroying your life in a heartbeat.
There's a lot of other studies. The University of Pennsylvania have done a lot where normal dogs with normal hips that have extra weight, those hips degenerate faster than dogs with dysplasia, but are kept at a light weight. So it's actually, we look at weight loss as a therapy for arthritis. 10% body weight loss is like giving a Rimadyl.
I think it's the same way it is with a human. Look at all the humans that have... I know, but all the humans that... I had knee surgery too, but people that I know that have had knee surgery and just are so overweight, they just never can recover properly.
Okay, well, we're going to go scrub-a-dub-dub and head on in, take care of Daisy.
Right now, I'm standing outside the surgery room, and so is the cameraman, and Dr. Rummel's inside with his staff. We want to keep it very, very sterile for this particular procedure. So he's going to be explaining a few things to you as they try and remove some of the fat area, right, Dr. Rummel?
That's correct.
And they've got the dog. It's Daisy.
This is Daisy.
Daisy. Okay.
And actually, Daisy's mom is a doctor as well, a physician.
Okay.
So she found out about stem cell and thought it was a good idea, and that's why Daisy's here. And Daisy has damaged her left cruciate in the past, which had surgery on it, and also has I have a blade. Oh, here it is. And she recently damaged her right cruciate. However, she has some significant issues with her hips as well, especially her right hip. So that's why we're going to implant stem cells into there today. So we're going to make a fairly large incision here because we're going to be trying to harvest some fat.
Is that reasonably shallow, that incision, since I'm out here and I can't quite see it that far?
The incision is going to be all the way into the abdomen.
Okay.
So just like if we were making a spay, only it's closer to the head because that's where the fat is underneath that I need to get to. Mm-hmm. And it's just regular good old fat. And these stem cells are, as we talked about, 8 generations away from embryonic cells. They are what's called directed cells. So, oh man, look at that. Isn't that great? So directed cells means that they can turn into any kind of tissue that deal with the inside of the body. And that would be tendon, muscle, ligaments, bone. I was at a conference last week.
You got quite a bit out of there, didn't you?
Well, we're going to see exactly how much. Carol's going to tell me here how
it's
much
like
I get.
liposuction.
There you go. Well, and they actually can get that with liposuction.
I was going to say, I wonder if they would use that with the human. Do they?
Well, you need a little bit of vascular. What we're going to be making here is a sort of a soup that contains what's called the vascular stromal fraction, and that just is a group of cells.
And that's what you were able to take out. Now, will you need more than that?
I don't know. I'll let you know in a second.
Probably got too much. I got 35.
So we need to get rid of some. We need 20 grams.
All right. And 20 grams will allow us to make how many injections afterwards, possibly?
Just a hair less.
It depends on. We're going to be making 3, but we're going to be sending. A little bit less.
If you can see what they're doing here is they're measuring exactly the weight of the fat, and they're going for what, 20 grams, you said?
20 grams. The problem with this procedure, I mean, it's fairly, baby, right on.
All right.
Okay, it's very, very important, the sterility of this, because stem cell, the benefit of it is tremendous, because you're taking the animal's own body. You're changing it a little bit, concentrating the important things and putting it back in. So the chance of reaction, there's no drugs,
rejection.
It's a natural process. The problem is if it gets contaminated, you're putting that into those joints too. So it's very, very critical that we stay sterile in this procedure. Okay, so Carol's going to start the process, and
that's done now as far as Daisy's concerned.
Daisy for a while till this afternoon.
Well, until we get that, but as far as removing anything, we've gotten everything we need.
We've gotten everything we need with Daisy.
And now you're just going to restitch the abdomen.
We're going to restitch that abdomen, close everything up, make it look real pretty for her.
Okay. Like a bikini line.
There we go.
There you go.
When we're done here, we'll take a picture of those over there where Carol is, but we'll stay away. But it's basically a series of steps of mixing the tissue with enzymes, putting it in a water bath at a certain temperature, spinning it at a certain speed, taking off certain things, then doing it again with a different enzyme. And so you're essentially digesting the things you don't need so that you end up with what you do need.
Now, over your shoulder, the cameraman is able to get a picture of Carol doing a lot of that, so we're getting that from a distance right now. And now she's putting that into what, is that a centrifuge, or what is that?
Why don't you tell them, Carol?
Carol, what is that?
It's a centrifuge.
Okay.
I'm going to see if I got the basic serum off. I'm going to see if I can get just a little bit more. Sometimes you spin them after that, you get just a titch more.
Is that the PRP, or is that the...
This is the
Yeah, that actually is not the fat. That's the...
the fat is over. I'll work on that when I get this.
Remember, we did
Okay.
the PRP first, and she's working on both those. That process is going on simultaneously.
Dr.
You have
Bummel, how
some
many of these
number?
has Camboro done?
I think Dr. Sliker's done close to 20-some, hasn't he? And I think I'm in that area too. I would say we're getting probably pretty close to 40.
And how long have you been doing this?
2.5 years.
About 2.5 years? And in your opinion, does the recovery, or not the recovery, the improvement rate on a dog is what, 100%? 80%?
I wouldn't say 100%. I don't know of many failures of the... the only one I had that did not turn out well was actually a compassionate care. In other words, it was an off-label use. We had to get special permission from the company and the owner and whatnot. We were trying to do some work with spinal cord because that is a tissue that this will work with. We had already done one that was hugely successful, a dog that had had some degenerative processes in the spine, and after 12 weeks it was able to walk and actually lifting its leg to urinate, and it was very good. It ended up bloating from a different reason, had nothing to do with the stem cells. It was a large dog and ended up having to be euthanized because of bloat.
Here's a question for you. From the first time you did it, this is a personal question. From the first time you did it till now, what has changed that is making you believe that this is, without a question, something we should be doing and something we should be considering for our pets?
I think for me, now I'll tell you what, with the initial literature I saw and some of the studies in humans, the experimental studies, I was gung-ho, and I think the best thing to do, I need some numbing, please. The best thing about it, I think it's just becoming more and more verified. I was at a meeting last week on pain control, and 2 of the papers presented were on cruciate ligaments in utilization with stem cell therapy. So it's just becoming more and more and more. Some of the exciting things that they have, they're actually developing techniques to strip cells or surfaces off the cells that make them be rejected by another dog.
Oh, okay.
Okay, so that rejection. So now we're doing what's called autologous, meaning, or autonomous, the cells from this animal back into the animal.
Okay.
In the future, there'll be cells that you can take off the shelf and do it. There's a process, there's chemicals in the body that are called signalment proteins, and they're what the damaged tissue release that tells the stem cells, hey, we need some help here. And as they develop and identify more and more of them, it'll be, I think, pretty exciting. You'll be able to take stem cells off the shelf, put a signalment factor that says the liver's bad, and the cells go to the liver. So that's what's in the future, I believe.
As again, we're looking at, I think the cameraman is probably picking up Carol over there working feverishly on trying to get everything prepared so we can get to the next stage.
And that's about close to a 3-hour process.
Okay.
So we'll be seeing you then.
Why do you have to shave such a big place? Why can't you just do the one spot?
Well,
where
I
you're
will
gonna
be able
do?
to in the knee. The hip, I need a lot of
Okay.
a lot of area to manipulate that knee, because it's a tough joint to get into. The knee is not a very tough joint to get into.
So we're going to see you do a knee, and we're going to see you inject into a hip.
Hopefully.
Okay. Hopefully. Oh. Now, does this have to be done in a sterile situation?
Oh yeah.
Absolutely.
Yeah.
I figured it did.
So we'll be into the. It's not quite as important as the stem cells itself. Rather than that patellar ligament right there, we're going to go right in behind. You should feel a little divot there, and then that whole area on the
How's the
side.
little belly doing? Where we did our little. Oh my God!
Yep.
Isn't that amazing?
Okay, in fact, we could show that right now if you want. Okay. So Daisy is back under anesthesia, and as we looked at the x-rays and saw how bad her hip was and her knees, this is her knee that was injured before. And since we got a very good harvest with Daisy, we're going to actually put some of those cells into that knee that has been repaired before, because it's even though it's been repaired, it's still not normal, and we can actually put cells in there that can help repair the cartilage, help shape the ligaments back into normal condition, and the joint capsule, etc. So we're going to show you how we're going to put that in here. We're also going to put it in her hip. She's going to undergo a surgery for the knee that's recently been injured, and then we're going to put stem cells in that knee. Can we flip Daisy for just a second?
Well, I'll show you your wonderful work there that you did whenever you harvested
this
that
is where
fat.
we harvested this morning.
Fantastic.
Where her little incision is.
Okay. Could I ask a question? Why are we taping the tail and the foot?
Well, this has to be sterile, so we don't want hair getting into it. What we're doing here, this knee is the knee, and if you can see that rocking back and forth, that's not supposed to be doing that.
Is that drawer
That's
thing
that drawer that we talk about that they get. So that knee has been injured, and we're going to be putting a lateral stitch in there just to hold it stable until those stem cells get a chance to repair that ligament. Okay? So we'll be taking Daisy in right now. Okay, I'm going to go right beside the patellar ligament and the lateral aspect of the joint. There's a little hole, and you can feel in your own knee that area. So
Right behind you. I'll be on this side.
let me just get a touch of Jensen. Okay, we have a 0.3 mLs total of the stem cell, and we don't want any air in that needle. So, again, this is the stem cell solution with that PRP. The cells are floating around in that platelet-rich protein. We'll know if her okay, we don't want to go into that cartilage.
What are you looking? You're going into the cartilage, you said?
No, I don't want to. I want
You're
to
going
go
right into the joint?
Right into the joint space.
One of the things we talked about, now you're not going to use it all, that you took out several hours ago.
That's correct.
So you said that you're going to
pick
bank it. Can you talk about that a little bit while we're doing this?
Yeah, that's the what we have left. We're going to be doing a third in this joint. We're going to now roll Daisy over, and we're going to do the hip. And I'm going to do, after the surgery on the other knee, I'm going to put a 0.5 milliliter intravenously. Remember, these cells, and I can't stress it enough, because in the future, I really honestly believe this is going to be just a phenomenal technology for us. Those cells are called by different parts of the body that are injured. Those signalment factors, they're called. And so when we put that in the vein, whether it's the liver, whether it's the heart, whether it's the kidneys, there's even, I just read papers last week at a meeting about allergy issues and how but they don't have any firm data yet to be able to say, oh, it's going to work for this length of time, or that it will work for allergies. I've had a number of dogs that we treated, a little Shih Tzu that comes to mind that was terrible allergy problems and many, many bad joints. And that dog's allergies for probably 8 months, just were tremendous. But we don't have any firm commitments. We can't say this is going to make your dog's allergies go away for 6 months. We do have the information on these, although the time period we don't know. It depends on, again, it's like a bearing in a car. That bearing is bad, and you can add extra thick grease and you can add things, but if the anatomy, if the function of that joint isn't normal, it's going to get bad again.
Well, now, how long did you say you've been doing this here at Camboro?
2.5 years.
2.5 years.
Our oldest client, or our oldest case, Amelia, just passed away. She was over 17, almost 18 years old.
Wow.
And we did her hip and her elbows and actually her lower back.
What kind was she?
She was was she calico, wasn't she? Little calico kitty.
Oh, wow.
But she couldn't even get into her litter box to urinate. She was so bad. And she was very docile, and which was unlike her. And so when the owner said when it started to work, she knew it because she was getting her old personality back. Okay,
and you said that the banking is sent to California?
Not up as far.
Correctly?
Yes.
With Daisy's name on it?
Daisy, yeah. Okay, rotate. Okay.
And are you the only doctor here at Camboro that does the
No,
stem cell?
Dr. Sliker also does it.
Okay.
Rotate. No, just hold.
I think, but I could
Rotate.
be wrong. I think you're one of the only veterinary hospitals in the area that does this.
Rotate.
Or that
Yeah,
I've
I'm
heard of.
really not sure, to be honest.
No, I
Go ahead,
haven't heard of
rotate.
it, so I'm always
Rotate.
willing to find
Okay.
where someone's doing different.
Back. Okay, rotate out. Yeah, no, just roll it.
If you've noticed on a lot of the
Bend,
programs
and
we've
roll.
done here
Just
at
stay-
Camboro,
okay,
Mark
hold,
is
hold,
usually
hold.
in on them, and Mark has been here 16 years, shake your
14
head.
years.
14 years. And Carol, who did the work with the stem cell, has been here
16.
16 years, and somebody else who was helping us before has been here 24, 26, 24. Pat, 20, was 24,
Patty,
26,
yeah.
yes. So I noticed that most everything that I've been here with you, you've had Mark help you.
Well, they all are. We just have an unbelievably excellent team. Mark has a little more knowledge with the IT stuff. So we call Mark in
When the computers are having an issue.
When the computer, I'm going to need more.
The doctor of computers, is that what he is?
Yes.
Okay.
And so what, a lot of this stuff is high tech. Okay, I need just a little more.
And how soon will we see if there's been any change here for the dog? How soon would the owner be able to see that there was a difference?
The owner will see change within 2 to 3 days, but not from the stem cell. Remember, this is, I need the spinal.
Takes a while for that to
yeah.
take effect. Okay.
We're going to use a little different needle here. It's a spinal needle. Okay, rotate again. Rotate out. Oh, okay. Rotate gently. Let me see.
And the exact placement is
Rotate.
important, obviously.
Back the other way. Oh yeah. Well, there's things called nerves and vessels in here that whoop, there we go. Let's See how easy that goes in there?
Absolutely.
That's one of the ways you know you're in the joint rather than into another tissue.
Goes in right away.
And
You want a little flush with that?
yeah. I use the longer, here I got this one. Oh, here. The,
Cherry thing in that.
no. Now I almost forgot to mention here, these cells, when Carol was done with them with all the different procedures, that there's another laser that is used that these cells are in because they're asleep. They haven't been woken up yet. There's nothing telling them. And so to help them, what we do is there's a laser, you have some gauze. There's a laser, a 3 light spectrum laser for 20 minutes that actually activates these cells and stimulates them to start to divide. So, alrighty, Days.
Okay, it looks like Daisy's ready to go, and now you're going to do some additional things which we're not going to be able to stay for, but you're going to be doing some additional things on the other knee.
Dr. Sliker is going to be putting in a support stitch in there to help stabilize that knee, and then we'll put stem cells in, and that'll hold that into position for the 3 to 6 weeks until these things really start multiplying.
One quick question.
So,
How would a person know that stem cell was a possibility? Is there anything that the owner would see, or?
You mean as far as case selection?
Yes, yes.
Well, a lot of times it's attitude. So many people say, oh, my dog's not in pain, he just has trouble getting up. Well, pain, as most people know, many different kinds of pain. There's that deep ache, there's that sharp pain, there's the throbbing pain, and so it's very different. If an older dog or even a younger dog, his attitude changes, they don't want to go on their walks, they don't go as long on their walks. If it's when they get up, they're hurting.
Yeah.
And there are things that can be done, and once you start to hurt, and once you don't use those muscles the same way, then that atrophies,
Right.
your joint gets more unstable, and everything progresses and rolls downhill. And there's many other therapies other than stem cell. So it's not like it has to be $1 million procedure, and this is $1,800 total. And with the technology and that's involved, it's certainly not a cheap date.
No.
But it's certainly well within reality of being able to do it.
Is there information about this on the Camboro website?
If there isn't, there will be. There's a link. I believe.
a link.
Isn't there a link?
Is there a link?
Yeah.
Mark?
And there's
Okay.
yeah.
So people can go there and they can find out more information.
Yep. And feel free to call. And again, it's a process that we go through. And every candidate does not, just because you want it, doesn't mean it's going to get it. We have a dog that they have to have some joint left, or the stem cells won't work. And we have a number of joints. I have a dog tomorrow coming in. We're going to be injecting the joint, but the stem cell. It's a palliative thing because there is no cartilage left. There's nothing to work with anymore.
Well, you've given us a lot to think about. Thanks very much. We appreciate it.
It's an exciting technology that works.
It's been wonderful spending all these hours with you today. See you later.
Thank you very much.
All right, bye-bye.